Hello friends, this is your forensic med mentor, and again welcome to the series of previous year question topics which we are looking at. So a very important topic is opium. Opium, actually two questions have come in INICET November 2023. One question was regarding its history, how it was traded, where it was traded, and the next question was regarding its toxidrome or the clinical feature. So coming to opium. Opium is a narcotic drug under the NDPS Act. Full form NDPS, Narcotic Drugs and Psychotropic Substances Act of 1985. So opium is a somniferous agent. Opium is a somniferous agent. That is, it is a sleep inducing agent or drug. Now we will study about the opium plant. Opium has other name. Other name is Afim. Very popular name, Afim. Other than that, the name are Madak and Chandu. Actually, this Madak and Chandu are the smoked form of opium. So, from which plant this opium is obtained? You have seen the picture of this plant. So, what is the name of this plant? It is known as poppy plant. Other name for poppy plant is Papaver somniferum. Papaver somniferum. So how the opium is obtained? It is actually the dried extract from the poppy plant. Actually, according to the NDPS Act, only 3 states are allowed for cultivating opium. We can remember 3 states which are allowed for cultivation by mnemonic rum. So what are the rum states which are allowed for cultivation of opium under the NDPS Act in India? Rajasthan, Uttar Pradesh and Madhya Pradesh. So these 3 states are allowed for cultivation of opium or the poppy plant in India. Now going to the plant itself. So if you look at the plant, there is a capsule and a thin long stalk. So how opium is cultivated? Actually, unripe capsule means when the capsule will be green, it is ideal time for cultivating it. What is done actually? If you see this image, longitudinal incisions are made. When these longitudinal incisions are made, white color juice or exudate comes out. So, when longitudinal incisions are made, milky white juice or exudate comes out. This milky white exudate is allowed to dry. And when it becomes dark brown in color. So when it becomes dark brown in color, this exudate from the capsule are scraped off. Next, if you see the below image, you can see inside the capsule there are seeds. These are known as poppy seeds. This we use in cooking. It is non-toxic. We're using it for cooking. It is non-toxic. क्या नाम है? Commonly khaskhas, or in Bengali we tell it as posto. Okay. Next, coming to the derivatives of opium. Broadly, there are 3 classification of derivatives. First is natural. Next set is semi-synthetic. Next set is synthetic. So we have three derivatives: natural, semi-synthetic and synthetic derivatives. Under natural derivatives, example is morphine, which is used as analgesic. We have thebaine and we have codeine. Codeine used as antitussive. Under semi-synthetic, we have heroin and codeine. Under synthetic, we have methadone, tramadol and pethidine. So these are the derivatives: natural, semi-synthetic and synthetic of opium. Next, coming to the clinical features of opium toxicity. Actually, this opium toxicity has three stages. We have stage 1, we have stage 2, we have stage 3. First stage is known as stage of excitement or euphoria. Then we have stage of stupor or depression, and last stage is stage 3 of narcosis and coma. Okay, so actually this opium is acting on the opioid receptors in the brain: mu receptors, kappa receptors, delta receptors, and causing stimulant or depressive action. So in the stage of excitement, initially there will be a sense of well-being and euphoria. Along with this sense of well-being and euphoria, you will find the patient to be talkative. There will be talkativeness. Along with it, signs of tachycardia and palpitations will be present. Also, there may be hallucination. Next stage is stage of stupor or depression. It is depression in many centers. First and foremost is the center of respiration. So there will be respiratory depression. Bradypnea will be there. Along with it, we will get headache, nausea, vomiting, and pinpoint pupil. Pinpoint pupil. And bradycardia also will be present. Bradycardia will be present. Then stage of narcosis or coma will come. In stage of narcosis coma, there will be absent reflexes, relaxed muscles, and along with it, the patient will have hypothermia, because there is depression of centers. So thermoregulatory center will get depressed and it will cause subnormal temperature, hypothermia will be there. Along with it, there will be hypotension, as BP will fall because of vasomotor center depression, and pinpoint pupil will be present. Next, coming to the antidotes for opiates. So before that, what are opiates? Opiates are derivatives of opium alkaloids. These are actually that natural and semi-synthetic derivatives you saw. Okay, morphine, heroin. Okay, they are opiates. What are opioid? Opioids are substances having opiate-like activity. Example what we can give is methadone, pethidine. So this is the opiates and opioids. These are derivatives of opium alkaloids, and opioid is opiate-like activity. So we were in the antidotes for opiates. So in antidotes for opiates, first and foremost, the specific antidote we have is naloxone. It is the antidote of choice. Antidote of choice. Next we have naltrexone. we have naltrexone. Naltrexone is used for treatment of opium addiction. Used for treatment of opium addiction. And we have third N, nalmefene. It is used for acute opiate poisoning. It's used in acute opiate poisoning. So we have 3N, naloxone, naltrexone, and nalmefene. Naloxone is the specific antidote, it is the antidote of choice for opiate poisoning. Next, coming to morphine withdrawal symptoms. So by withdrawal, what we understand? It is because of physical and psychological dependency to the drug. Withdrawal is because of the physical and psychological dependency of the drug. So what are the features of morphine withdrawal? In morphine withdrawal, we will see increased yawning, and there will be increased secretions in the body. Because of that, what will happen? We will get rhinorrhea, excessive sweating, diarrhea, and increased yawning, increased secretion. Along with, we have opposite effects of morphine. Instead of meiosis or pinpoint pupil, we are going to see mydriasis. So we will see the opposite effects of morphine. As you have seen the clinical features, these three are the stages. If you are at the toxidrome, you have to see, we have a triad. What is the triad? Triad of opium toxicity. So this triad consists of respiratory depression, coma, along with it pinpoint pupil. Okay, this respiratory depression is the most specific feature. Along with it, this triad is there of coma and pinpoint pupil, and this respiratory depression becomes the cause of death. The patient will invariably die because of cause of death is respiratory failure. So this is about the triad of opium toxicity. This is question has come with these features, you can understand and apply that this is because of opium. This poisoning, the cause is opium. Next is in morphine withdrawal, physical and psychological dependency. Because of this morphine, we are having withdrawal symptoms. Increased yawning will be there, increased secretion like rhinorrhea, excessive sweating, diarrhea. Opposite effects of morphine, like instead of meiosis, mydriasis is happening. So what is the drug of choice for it? Drug of choice is oral methadone. We are using oral methadone for morphine withdrawal symptoms, and not only for morphine withdrawal symptoms, also for addiction. This drug of choice for withdrawal and addiction. Okay. Coming to heroin abuse. Heroin, its name is diacetyl morphine. What are the street names? Street names, if you see, we have smack, dope, or brown sugar. If you notice, as I have told, this dried exudate will be there. The dried exudate will be scraped off. This dried exudate actually, which is scraping off, is known as crude opium. So this initially it was milky, then it will become dried, and it becomes dark brown in color. Crude opium. Okay. So if you see the name, we have smack, dope, and brown sugar, diacetylmorphine, and it has found to be more addictive, more addictive, and 2x potent than morphine. This addiction will rapidly become tolerance in heroin abuse. So, what are the methods of heroin abuse? Methods of heroin. So, first method is chasing the dragon. What is this method, chasing of dragon? A spoon is taken, in that aluminium foil is kept. Over that aluminium foil, this heroin is placed, and from below it, it is heated. Then the vapors which are coming out, the smoke which are coming out, are inhaled. This method of abuse is known as chasing the dragon. Okay, chasing the dragon. So the powder is placed in an aluminium foil. In a spoon, then heated from below, then that smoke or vapor is inhaled. So this is chasing the dragon. Second is main lining. Main lining. It is the IV drug abuse, IV injection of the drug. It is IV drug abuse. Because of this IV drug abuse, along the track of the needle, we may get needle track ulcers. Needle track ulcers. Then we have the third method, that is skin popping. Skin popping. It is actually taking this heroin via IM or the subcutaneous route. So by taking, if you are taking IM and subcutaneous injections, it is known as skin popping. Because of this skin popping, you may get geographical ulcers over the body. And usually whenever there is injection marks are there, there will be hyperpigmentation of the area. To conceal that, usually these addicts will make a tattoo mark over it. Okay, there will be tattoo over it to conceal those injection marks. Now some names of combination abuse. If a IV heroin plus cocaine is taken together, it is known as speedball. If heroin plus strychnine is taken together, strychnine is a spinal poison. If heroin and strychnine is taken together, the name is hot shot. You can easily remember H for heroin, hot, then S for strychnine, shot. And one very important bedside test is available, that is Marquis test. So Marquis test is a presumptive spot test. Presumptive spot test for opium alkaloids. For M, you can easily remember morphine, which is an opium alkaloid. So Marquis test is a presumptive spot test to detect opium alkaloids. So what happens in this? Marquis reagent is used, that is concentrated H2SO4 plus formaldehyde. This Marquis reagent is added to the suspected sample, and if purple black color comes out, purple and black color mixture comes out, it is presumptive for opium alkaloids. So this is about the Marquis test. M for morphine, M for Marquis test is a presumptive spot test for opium alkaloid. If purple and black color is coming out, it is presumptive that opium alkaloid is present. A bedside test with a suspected sample of opium you can do. Thank you. So this was a very important topic for your entrance exam, and questions may come regarding its historical background and clinical features. So talking about the historical background, actually this drug in 18th century was traded in China. The British Empire used to trade this Afin, opium, to China. So this was the question in INICET. Which drug was traded as substance of abuse was traded in 18th century during the British Empire period? The answer is opium. Okay. Thank you.